Good soul crew, and I'm Erwin from India, and I'll explain about health center. And as you know, this is our station's model, and we have launch center, main station, and health facility. And I will explain about health facility. Yeah. First, let's look into what are the responsible of health facility. It is responsible for all medical emergencies and follow-up healthcare for the astronauts, like surgeries and complex medical procedures, and injuries treatment, mental care, and routine checkups. And let's move into the design part. And this is my design. We'll design with three floors: ground floor, first floor, and second floor. In ground floor, we'll have emergency and surgical area, and in first floor, we'll have medical storage and research lab, and in second floor, we'll have psychological and health attendants. Now, let's move into ground floor. And as we know that ground floor is for emergency and surgical area, this is the area for medical emergencies for astronauts and necessary and urgent operations for astronauts with robot assistance will happen in this area. And this is the infrastructure of ground floor. And we'll move on to first floor. And first floor is for medical storage and research lab. Better storage is better care. We know that. And to store massive amount of medicine, this medical storage will be used. And researchers will research and develop new drugs in research lab. And this is the medical storage, and this is the research lab. And let's move on to the second floor. Second floor is for psychological and health attendance. Here we'll analyze astronauts' body status every day, and also we'll analyze astronauts' mental status here. And let's see. Astronauts have been observed to suffer from depression, anxiety, fatigue, and emotional instability, and feeling of isolation and boredom, and the knowledge that the Earth is very far away, and long periods of confinements are some of the mental issues researchers worry about the crew members. And let's move into the applied technologies. And we know that fully equipped ICU, lab with rugged equipments, and foldable X-ray machines, and bed elevator, clinic equipped with primary healthcare necessities, and robots. And let's move into management. And under facility chief, we have three crew and researchers and surgeon and medical doctor and a nurse. And the duties of the astronauts will be the medical doctor will be in the charge of any non-surgical emergencies, and general surgeons will perform any emergency life-saving surgery with the help of nurse. The nurse will be responsible for the periodic checkups and assisting both doctors as needed. And researchers will develop new drugs. And astronauts training program, both the doctors and nurse should have registered medical license and are well trained to work with the common space health condition. In addition to extra training regarding mental health, especially warning signs of any psychiatric disorder, and then can be guided by a psychiatrist from the Earth via telemedicine to do the recommended therapy or to take specialized consultation. And it is important that every astronaut should be trained to perform CPR and basic life saving skills in case the medical staff itself was affected. And these are some of the YouTube videos to train astronauts. And this is the resources. As this is a health center, we need first aid kit and 3D printers to design all needed medical and surgical equipments and supplies from greenhouse to make medications. And we need required amount of food and water, and the diet and amount of food to be consumed by each astronaut will be determined by weight, height, biotype, and routine of the astronauts. And guidelines. Most of the medical conditions that happen in space are not medical emergencies and can be treated on board. Astronauts with common complaints like headache, motion sickness, sleeplessness, and back pain can be prescribed medications as per established guidelines. Other conditions like sudden minor trauma, burns, musculoskeletal injuries, and so on will be dealt within the ground floor. And let's move on to protocols. And medical emergencies to be treated on the ground floor and refer to surgery if needed. And regular checkups and psychological therapy can be done in the second floor. And medical researchers will be done in the first floor by the researchers. And protocols of safety, the surgeon need to scrub in before performing any surgery. And disposal of biological and chemical waste has to be done properly. Sharp objects need to stay contained in a safe container and should be disposed safely after using. And we can use VR headsets to entertain our crew members. And pills and injectables will be made in the lab with precursors supplied from the greenhouses and other production facilities. And protocols for 3D printing, medical devices that need adjustment of the size to fit each astronauts, and materials needed for physical examinations, any specific medical device needed for investigations. And let's move into spin-offs and technologies that are also can be applied to Earth. 3D printing for surgical equipments and medical materials, and reusing medical devices after sterilization, and producing drugs instead of waiting for resupply. And impacts of sustainable development goals, improvement in access to health quality healthcare, and structured healthcare units including high-tech machinery and equipment with pharmaceutical industry, and improvement in the quality of medicine. And this is my personal context. Thank you.